FamiCord is the leader in the field of stem cell banking in Europe. We are operating 15 banks all over Europe and also outside of Europe. Our core expertise is cord blood banking and perinatal tissue banking. By banking of the perinatal tissues, the families can have more options to the stem cell therapy when it's needed. We are active in cell product manufacturing. We have 2 manufacturing sites, one in Portugal, the second one in Poland. On top of that, the scale of our activity is unique. We can work in a multinational way due to our infrastructure, which is in many countries. We have a sizable teams in terms of R&D, medical and logistic, which are sometimes necessary for a larger projects.
I think FamiCord have shown with 1 million storage samples and with over 8,000 patients treated that we are basically one big company directed at helping patients.
Cord blood is one of the well-known, widely used sources of hematopoietic stem cells. It may be used for both allogenic and sometimes even autologous transplants in both malignant and non-malignant disorders.
Those cells are much younger than the cells which you usually take from the stem cell donors. These cells can multiply well and they have much better graft versus leukemia effect, but also less graft versus host disease effect. So these are the transplant types that lead to more healthy life afterwards in our patients.
At the moment, the results from Japan, UK and the USA show clearly that unrelated cord blood stem cell transplants are really superior in terms of outcome for patients with refractory acute myeloid leukemia, meaning the patients who are MRD, minimal residual disease positive, at the time of transplant. The relapse incidence is lower because the graft versus leukemia effect is apparently much better.
We need to change our thinking about the umbilical cord cells because we know that this is a huge heterogeneous group of cells in this material and we can use different type of cells for different purposes, from basic science to clinical use.
To offer the service of storage for so many years, the trust is necessary, that the parents know that whatever we do with the due care to provide the cells in good condition for any applications which may arise in the lifetime.
We have certificates of quality from non-profit organizations like AABB or FACT NetCord, and 2 of our laboratories in Poland and in Portugal accredited in good manufacturing practice. It allows us to produce advanced therapy medicinal product. We have in total 13 laboratories located in Portugal, Spain, Switzerland, UK, and in Turkey and in Dubai in Emirates. We always wanted to be very close to our customer. It's much better in terms of quality of product, logistic, ensuring people that their cells are close to them and there is a medical need.
We see our role also in a storage and cooperation with the transplant clinics. We are up to date in terms of the conditions for storage required by the transplant centers. We are collaborating with transplant centers and the doctors which are interested in perinatal stem cells applications. We are actively sponsoring clinical trials which are using the stem cells in the therapy.
Having the opportunity of producing cells and cellular therapy products from banked cells, we can give additional chance for the treatment of many diseases.
We launched a couple of programs where we give back to the society. The first such a program is a direct donation programs.
It's directed at the families who have a child which gets leukemia or another disease that needs transplant. In such cases, if mother gets another child, we will collect for free cord blood from this child so it can be used to cure the older sibling.
The other activity involves hybrid banking. So in some countries in Europe, we make it possible that the family who is banking the cells for themselves also can agree to perform additional tests, and then such a sample can be used for the unrelated patients. The third initiative is related with the public banking. We are collecting the samples for unrelated use at our costs, and then those samples are available for the transplantations. We are the expert. We have teams, infrastructure, experience. So I believe that we are a good partner for different organizations to do joint projects.
My hope is to have a situation that much more people can know the benefits of storing cord blood and cord tissue cells.
This is easy to access biological samples which can be used for different purposes, not only transplantation, but also gene therapy, CAR-T therapy, different type of immunotherapies.
At the end, this is the thing which is really important. When you give the cells, when you give therapy to the patient and you see them overcoming disease, and you can meet them for many years afterwards.